Welcome back. I'm Les Flamer, founder of the Medigap Savings Network. I'm a senior like you, and my focus is to help other seniors make good decisions and save money on Medicare supplemental insurance. In our first module, we looked at the things you need to do now to get signed up for Medicare. In this module, we're going to focus on Parts A and B covered services, Part D prescription drugs, and we'll also explore Medicare Advantage and Medicare supplemental insurance in a future module. So let's get started. Most people receive Medicare Part A hospitalization insurance at age 65 at no cost. Basic benefits include inpatient care in a hospital, inpatient care in a skilled nursing facility. It does not include custodial or long-term care. Care must be related to an inpatient hospital stay of at least 3 days. And they use the 3 midnights rule. That means you have to be there for 3 midnights, consecutive midnights. Hospice care. In order to qualify for hospice care, a doctor has to certify that death is likely within 6 months. Home health care with certain restrictions that we'll discuss in greater detail later, and clinical laboratory services. Medicare pays 80% of approved services. Your share of cost includes the Part A deductible and coinsurance charges of 20%. That means you pay 20% of the bill plus deductibles. The Part A deductible is $1,340 for 2018. You pay the first $1,340 of Part A related charges per benefit period. The first day of hospitalization is the beginning of a benefit period, and the period ends when you have not received specialized care in a facility for 60 days in a row. It is possible to have multiple benefit periods and multiple deductibles in a single year. Coinsurance charges are 20% of the balance of charges not paid by Medicare. Medicare covers the first 60 days of a hospital stay. For extended stays, you share charges. For days 61 to 90, you pay $335 per day. After 90 days, there is a single lifetime reserve of 60 days, and you are responsible for a charge of $670 per day. Thereafter, there are no benefits. Even if you stay in the hospital overnight, you may not be classified as an inpatient. You may have been admitted for observation. This distinction is key since you must be classified as an inpatient to qualify for some other future benefits. To qualify for the skilled nursing benefit, care must be medically necessary and related to an inpatient hospital stay of at least 3 days. Medicare pays for the first 20 days. For days 21 through 100, the patient pays $167.50 per day. Thereafter, the patient is responsible for all charges. Medicare Part B covers medical services, including physician services, inpatient and outpatient medical and surgical services, and supplies. It also covers therapies, diagnostic tests, and durable equipment. There is an annual deductible. For 2018, it's $183. Medicare covers 80% of approved charges, and the patient is responsible for the remaining 20%. For home health services, Medicare pays 100% for medically necessary skilled care services delivered by a medical professional. That's key. This does not include custodial care. Home health care is provided only for medically necessary services delivered by a healthcare professional. Examples of typical services include intravenous drug delivery, physical therapy, and other medically necessary services. This does not include assistance with the activities of daily living, eating, bathing, dressing, transporting, toileting, continence. That is all considered custodial care. Medicare prescription drug coverage is provided by independent insurance companies who charge a monthly premium. Each offering is slightly different. Most have annual deductibles. A few have zero deductible, but charge higher premiums. Most deductibles are about $400 per year. Each insurer has a formulary or schedule of drugs they provide as part of their plan. Drugs are in different tiers ranging from low-cost generics to very expensive specialty drugs. Drug charges are based on a fixed amount for a tier or a percentage copay. Even if you're not taking prescription drugs, it's wise to sign up. You may need expensive medications in the future, and joining the plan late incurs a penalty of 1% per month for every month not enrolled when eligible. As you can see, Medicare covers about 80%. That still leaves 20% for which you're responsible. This can be very substantial if you do incur a major long-term illness, major surgery, or treatment for one of the big three: cancer, heart attack, and stroke. The lifetime risk of suffering cancer, heart attack, or stroke exceeds 50%. That's the chance of getting one of those in a lifetime is nearly 50%. Clearly, the incidence of one of these being fatal continues to decline, but treatment regimens are costly. Fortunately, there are two approaches for covering these areas of potential major healthcare expense: Medicare supplemental insurance and Medicare Advantage plans, and we will be covering these in our next module. If you have any questions, give me a call, send me an email. I'd look forward to hearing from you. We can certainly provide greater detail and depth, and our services are completely free. Thanks again, and look forward to you joining our next module.